Hey guys, my name is Daniel. I am an ER nurse from Toronto, Ontario, Canada, and this is my lockdown diary. Let me show you guys a bit of a day in the life of a frontline healthcare worker during the COVID-19 pandemic. I set my alarm clock for 5:45 to get ready for my 7 a.m. shift. I get up and change to my uniform first. Then I head downstairs to grab a quick bite to eat. I pack my lunch for the day, put my work shoes on, and hop in the car. Don't worry guys, I've done the other essentials. At this point I've also brushed my teeth, I showered the night before, so I'm pretty clean. The drive to work is about 20 minutes. Today is a Thursday, and even so, the good thing is that there isn't really that much traffic to and from work. I work 7 a.m. to 7 p.m. today. As soon as I park my car, I hop out and complete my PreWork screen questionnaire. Fever of 37.8 or greater, I don't. Any diarrhea or vomiting, nope. None of that as well. I don't have pink eye, no cough, no shortness of breath, no sore throat, runny nose, or any loss in senses. No headaches, I'm not tired, no muscle aches, thank God. I don't have any confirmed or unknown contact with anyone with COVID without PPE. I haven't traveled outside of Canada recently, and I don't work anywhere else, so we can answer no to all of those questions. And this is my pass. I show this at the screener's door as soon as I enter. All employees in my organization, regardless of profession, are required to be fully vaccinated. Employees have a separate entrance compared to the rest of the patients coming in. As soon as I arrive at the door, I show my screening questionnaire completion, my green pass, and I receive a level 1 mask to wear while indoors. Since I already have a mask on, I don't need to get a new one, and then our shift begins. So I work in the emergency department. We are the first stop in the hospital for all the patients coming in. Essentially, we see a variety of different patient demographics, from elderly, pediatrics, mental health, maternal, so forth and so on. So I would say we are at pretty high risk of exposure to COVID-19, just because we don't really know what these people are coming in for and what sort of viral illnesses they are harboring. So what are some of the ways that we handle the pandemic? At triage, where patients enter and get screened initially, it is important to ask the following questions. Are you vaccinated? How many vaccines have you gotten? Are you having any symptoms of COVID? Any headaches, fever, loss of sense of taste or smell? Any shortness of breath, difficulty breathing? Is there anyone sick at home? Have you traveled recently, internationally, and to where? Once they pass triage and get into the main emergency, where I work most of the time, we then assess them more thoroughly and do a head to toe. You said that you got both vaccines. Which vaccines did you get? Pfizer and Pfizer? Did you get a combination? Did you get one that hasn't been approved in Canada? I see that you aren't vaccinated. Any particular reason for this? Do you have a medical reason? How long has your fever, cough, or your shortness of breath been going on for? This child, does he or she go to daycare? And if so, are you aware of any sort of viral outbreaks? After asking some of these important preliminary questions, of course, we obtain a full set of vital signs for COVID-19 patients. Respiratory rate and oxygen saturation seem to be the two sets that sort of show a change more prominently than the others. We also have several mandates that help protect both the staff and the patients while they are working in the emergency department. All employees must always wear a level 3 mask. We also have 4 different levels of masks available to us in the hospital. Level 1, Level 2, Level 3, and an N95. Level 1 is for the patients. We give this out to any patients coming in, and they are required to wear it while waiting in the emergency department. Level 3 is thicker, so a Level 3 mask can filter out far more particles than a Level 1 mask. A mask in general is better than no mask at all. And an N95 is used when there is a high chance for airborne particles to be present, usually with deep respiratory procedures. For instance, if the patient uses a CPAP or a BiPAP machine, or if we are doing an intubation, it is required that all employees within the vicinity be wearing an N95 mask with the door closed. The level 2 mask we used to use for our patients, but we don't really use it as much. Another mandate is bedside precautions for all patients. When they come to the ED, given the fact that it is possible to have COVID without being symptomatic, we always ensure to wear full PPE or personal protective equipment. Here's a video of my girlfriend Anna, who is also a nurse. She works on a medicine floor, donning her PPE before entering a patient room. She wears a gown, face shield, and gloves. We make sure to clean our shared equipment as much as possible. For instance, this vital signs machine, since it's going to touch most, if not all, of our patients, so we use antibacterial wipes that are available. And of course, don't forget about thorough hand hygiene before and after patient contact. We've been working pretty hard, so let's take a quick lunch break. In order to accommodate the large number of staff while also maintaining physical distancing, tables are separated deliberately with signs reminding us how many people can sit at one table. There's a cleaning station, which allows us to wipe the table before and after use. And this is me eating my lunch that I packed earlier in my own little corner. I usually like to watch an episode of my favorite anime and then spend the rest of the time either watching TikTok or taking a quick nap. Okay, back to work. This is what a PCR COVID swab looks like. It has a swab, which is notched in the middle, allowing us to break it off before we put it in the tube. The tube itself has a fluid to preserve whatever viral capture the swab had. Make sure to put the tube in the biohazardous bag and send it to the lab within 30 minutes of swabbing to obtain the most accurate results. Remember to follow good PPE technique. There are many signs reminding both patients and staff members across the hospital. Okay guys, it's been a long shift, so it's time to head home. Before I go home, I try to clean some high contact points starting with my shoes. I also wipe down my badge holder since I'm always touching it to get into rooms, etc. And I change into some clean clothes to avoid spreading germs to my car and to my home. It's just a quick walk back to the car. I feel tired and hungry, but it's time to go home and get ready for the next day. So that is a quick day in the life of an ER nurse. I worked 4 days straight. 2 day shifts followed by 2 night shifts, all of them 12 hours long. I then have 5 days off in between rotations. On my days off, I try to enjoy life as normally as I can, and I do like to do things such as enjoying nature, hiking, exploring, traveling, while being as safe as possible with my friends and family. I go to the mall like normal for some retail therapy. I go out to eat in restaurants, which now requires proof of double vaccination. I also go to the gym, gotta stay fit in order to keep up with the pace in the ER. It's also required to be fully vaccinated in order to use the gym facilities. Unfortunately, the COVID-19 pandemic is still here, and in my opinion, I think it will be here for a little while longer. But in the meantime, it is important to continue to enjoy the things that life has to offer, and that starts with connections and relationships with the people around us. Remember, you're not alone. Continue to eat right, continue to stay active, and continue to push forward. Peace.